So our next speaker is Dr. Carolina Lopez. She's internal medicine, so she's going to talk to you about scary internal medicine things. So this has all kind of been in the forefront of our minds, especially the last few years. So I'll turn it over to Carolina.
Thank you, Troy. Good morning, everyone. It's certainly a very lovely morning to have such a special audience, especially when it's not on emergency basis. So I'm sure you guys are very happy about it, and so are we, trust me. It's very, I'm very honored just to be able to celebrate this, this 50-year anniversary of this amazing place that we happen to spend daily. And also with all this mentorship that we have had, this hotel's legacy, but more than anything, you guys being here and being present for this. So I really hope you enjoyed the talks. The one that I'm going to be given today is going to be in regards of equine herpes virus, or EHV-1. So fun fact, before I start all this, I got multiple texts of people that had absolutely no clue of what EHV-1 or equine herpes virus was, and some other group of people that have been somehow affected by this disease in the past. So kind of like what we're going to do in the next couple slides is, these are kind of like the 6 boxes that I want you guys to check off. So we're going to talk about what it is, the disease. How can your horse get this equine herpes virus? The clinical signs that you guys are going to be looking for. We're going to talk a little bit about that outbreak that happened early this year that some of you might be aware, and this is kind of like why the importance of this disease, of knowing what it is and being able to identify it. How we can best test for this, and then more than anything, how we can prevent it for your horses to not happen. So when I was standing over there, I realized the letters can be a little bit small, so you're going to have to bear with my beautiful Colombian accent. Dr. Bird might have a different opinion about it, but we're not going to ask her, so that's okay. So you guys will know, some of you might not know about EHV, but you might know when you vaccinate your horse against like flu rhino. So that rhino stands for the rhinopneumonitis, which includes that equine herpes 1 and 4. There are 5 different types of equine herpes viruses, but for this presentation, again, I just want you to keep in mind the 1 and 4 that are the ones that cause some of the clinical signs that I want you guys to identify. This disease can cause like serious health risks to multiple horse populations, and the worst thing is that it's just distributed worldwide. There's no continent that is free of this disease. It can certainly affect that equine industry, but causing significant economic losses. And the really annoying part of it is that sometimes can come in a very sporadic manner, meaning here in the valley have happened like a single farm, no horses in, no horses out, and still one of them develop. Or it can happen more as it happened early this year on that outbreak that was massive and more than 500 horses were affected. So it's truly kind of like a silent risk that we have every year, and every year in our equine population can be different. Now, the other fun fact is all the horses are going to be exposed to this disease at some point in their life. And especially those that are like more than 2 years old, at some point they're going to be kind of like exposed to it. And some of them are going to develop the clinical signs and some other ones won't. And then they have like 4 different clinical presentations for that disease. 1 is the neurologic form. 2 is the respiratory form. 2 is the neonatal death, or just our foals like just dying shortly after they're born. And of course, for our pregnant mares, then that abortion risk. So how is this virus spread? Well, the most common way is in that like direct horse-to-horse contact. However, as we can all rely as horse owners, I'm sure you have been standing in front of your horse at some point in your life, and there have been sneezing all over you, and you can see how that shower gets. So this takes me back on how with COVID, you remember how we were saying like the 6 meters and like placing a llama in between? Well, with horses, truly, we have to put, I think, like 3 llamas, and if not, like 3 or 4 times the space, just because of that respiratory apparatus can just travel like really far. So we talk about that direct horse-to-horse contact, but I just wanted to keep that in mind, that it's just those particles can travel like really far. So even if we're not letting our horse just be right next to, and having contact with the other one, it can still spread out that way. It can also spread out with, physical objects, including us. So any grooming equipment, any of the feed and water buckets, and of course our clothing as well. So again, if we're standing right in front of when the horse sneezes at us, and then we go and see the other horse, and the horse just come to our clothes, then how we're going to be given to them. Okay. As far as clinical signs, we do have, the next slide is going to show you some of the things that I have in here, but fever, it's definitely going to be the first and sometimes the only warning sign of it. They call it more like a biphasic fever, meaning they get a little bit of a fever on day 1, and then they don't get another fever until day 5 and 6. I say that, however, reality is sometimes we don't see a fever, but for the most part, we do see one. And now, how do you guys know what is a fever in horse? Who can tell me that? Yeah, so it depends on a lot of things. It depends on the time of the day, right? But typically, it'd be like above 101.5, then is when I start like looking. I definitely want to recheck the temp on that horse, especially in a chill morning like today, where the hotels picked to make this conference to do it at. Having a 101 temperature will be a little bit unusual. So those ones are the ones that we want to recheck and make sure. But the one above 101.5 is what we consider, more like a fever type. It can also, as far as clinical signs, they can have respiratory disease. Horses can be really good at hiding respiratory disease. Some of them are going to be very obvious as far as the coughing, nasal discharge, but there are other ones that might not show you much of the typical signs that we see, more than just maybe a little bit of like breathing a little bit faster than usual. On our pregnant mares, then abortion can be imminent too. Most of these mares are going to be affected more in the late pregnancy, so more than like 7, probably like 6, 7, or 8 months of pregnancy. However, it can happen as early as 4 months. So every time this happens, and if you have more than one pregnant mare, at the farm, then again, this is one of the diseases that I want you just to keep in mind, and we'll talk more about at the diagnostic, but it can certainly affect your horses that way. And then last is, some of these horses can present a little bit of what we call neurologic disease. Neurologic disease is also known as equine herpesvirus myeloencephalopathy, or EHM, which is, again, very similar to the EHV, but it's just that neurologic form. Horses are going to have a lot of like hind end and coordination. They're going to be leaning against that wall or against the fences when you go out and see them. They're going to have a little bit of that urine dribbling, or some of them cannot be able to urinate at all. And some other ones are just going to be down with a little bit of inability to get up. So this is some of what we're describing. This is someone, like one that we assisted with the sling. I do have to say, not every horse is made up for slings. That's very particular, like personality, and them letting us help just give some support to. Sometimes we have to put actually just like bales of hay or bales of shavings so they can just lean themselves up. For those respiratory cases, then we do use, when they have the nasal discharge, some of the fever, then we use some of our nebulizing devices just to do some of the bronchodilators and antibiotics that can happen, secondarily to that viral infection that you're dealing with. And as we mentioned, the abortions, as I say, just keep it in mind, usually it's like late gestation, but it can happen as early as 4 months or 4 months of gestation, so we do have to remember that. This is some of like what I'm saying, as far as when horses, sometimes we just find them down. Horses are like animals of prey, right? So they're not really want to be laying down, even when you're their person and stuff like that, they still want to get up. And you can see how this horse, mentally, she looks that she's there. She has a little bit of abrasions on the right side, but it's just like that inability of get up. She just cannot physically put her legs down and just move up. As far as treatment, that's when it becomes challenging, because it's truly all about just supportive care. We have to place some urinary catheters, in these cases, as I mentioned, there's that urinary dribbling or just inability to urinate. For the abdominal sling, again, not every horse is meant for that, but sometimes we have to support them in some way. And truly it's just the anti-inflammatories, antiviral, and just like daily care. We do have a lot of or a lot of the treatment as far as with antivirals has been extrapolated from the human medicine that are dealing with herpes virus in humans. But when you extrapolate that to the horses, then it becomes a little bit more challenging as far as the bioavailability of the drug, meaning how much the drug absorbs in the horses and how much action it actually has. So it does help, but currently some of them can be extremely expensive. And as I say, the efficacy is not as great as it is in humans right now. So there's still a lot for us to learn in that sense. This can be a little bit too graphic, but it's, again, just to give you a little bit of an idea of what these cases can look like and how, prognosis can be very, very challenging once they're neurologic, once they're down. You're pretty much going to be dealing with a lot of like those pressure sores, the bandages, just trying to assist it, that urinary catheter that we see there as well. And then this one might look a little bit familiar, right? We just finished, I don't know how many years we have been now with COVID, 3 years, right? And then dealing with that global pandemic it definitely affect, I try to look at the numbers, affect like over like 6 million deaths were confirmed and over 500 million people affected. We're still dealing with it this year. Actually, some of our staff did get COVID as well. So it's just kind of like a never ending deal. And I want to think that horses this year wanted to be a little bit like us because it was pretty much in February was when the first case that we were dealing with the pandemic, and then horses decided to do a similar kind of viral outbreak. And of course, we cannot cover their mouths. And then this disease we have, I don't know if did you guys heard about that, the outbreak in Thermal, California?
Yeah, my business.
Okay. There you go. There's some people that were very aware because it affected in many different ways, and there's some others, as I say, other horse population that it did not. So we do count, so in February, when we started identifying some of these cases, it was challenging because by the time they start identifying and we start seeing, again, it's a disease that we know about, but then that all suddenly can just like spread all over. And then it was almost over 500 cases that were actually infected with EHV-1 all over California state. I don't know if you guys are aware, but we were shut, like multiple shows were shut down, more even not only in California, but out of state, and I would say out of the country as well. So we were like truly, truly in high alert. The CDFA staff have to work very, very tightly with all the people involved at the horse park, and then they had like really tight biosecurity measurements for all these horses. So in other words, it's a big deal, as I say, as it can happen just in an isolated farm, here in the valley or somewhere else. It can also happen in a huge horse park where you're about to go and you're about to expose those horses. So as far as diagnosis, and I know that bottom picture can give you a little bit of goosebumps. It does to me, at least, with all the nasal swabs that I had to get through this pandemic, back and forward. And when it first started, our practice manager was making us do a lot of that. So we all love him for that. But anyway. You can do nasopharyngeal swabs, which interesting part is that you see that nasal swab is truly, even though it is a horse size, is the exact same swab that they did for us. So that makes you wonder, but anyways, that's the one way, and then typically you'll see, like ourselves veterinarians, just when your horse has a fever, then we'll do what we call a respiratory PCR. So we can identify some of those viruses, not only the equine herpes one, but also multiple ones that can give you a little bit of that respiratory signs, high fever of unknown origin kind of tip. We also do some blood. So blood, it's a little bit more challenging just because depending on where, like when in the stage of the disease you do the blood, you can have your antibodies going up. So I always say, like those antibody titers can be useful if you already are kind of like with more severe clinical signs than you see there. But usually we just rely on that PCR on the nasal swab. Or sometimes we have to do the combination of both. So as far as prevention, and this is, I think, is the most, by far, the most important slide from all of them. So one take-home message that I wanted is make sure that every time you bring a new horse or something new is changing at your barn, or even the ones that are traveling constantly back and forward, that you keep them a little bit isolated or just not in direct contact with your naive population that I call like that stays back behind. Because those ones are going to be the most susceptible, as far as like bringing back the disease and affecting the other ones. If you do have pregnant mares at your property, make sure, especially if you have those show horses coming in and now, then try to keep them separated from some of those horses of training. As you know, in pregnant mares, we have a pretty heavy vaccination against equine herpes. They actually get 3 different vaccines throughout their pregnancies to try to avoid this. So again, it just makes sense just keeping those 2 populations separated. And of course, the moment you identify any horse with the clinical signs, then just take biosecurity measurements. By taking biosecurity measurements, we'll look at one of the slides, but if you have depending on where you're at and how your stall or how your barn is set up is going to be a little bit different, but just give us a call and we'll be happy to guide you through like what is the best as far as like implemented for your barn. And last one will be vaccination. I don't want to get too much into political stuff. I promise I'm not saying vaccination is that you do need to vaccinate. I actually have to say, as much as vaccination is good to help kind of like provide with those antibiotic titers that are going to decrease that length of the disease. And unfortunately, up to date, we do not have a vaccine that will completely prevent for those neurologic signs that I just showed you, like on those videos that those horses that go down. I'm sad to say that even now to date, we don't have one that completely prevent that. So even if you vaccinate your horse, that can happen, but it certainly have your best chance, if they do have the vaccine on board. AAEP is the American Association of Equine Practitioners, and then they have like 2 groups of vaccination that they recommended. One are kind of like the risk-based, so depending on where the area that you're at, depending on like what you do with your horses. So those ones will include the equine herpes virus. So again, most commonly as the flu rhino, or they combine the 2, the flu rhino one. There's the strep vaccine that will be, follow into this category as well. It will be the Corynebacterium vaccine or the pigeon fever one that here in the valley sometimes we can have some issues with. So this, again, AAEP can be a really nice webpage if you want to be more informed. This is always, as far as protocols, all this that is in this chart always needs to be discussed with your veterinarian, and then they can help you out as far as like, what to do. I'm more of the pro as far as I love vaccines, but I don't like to overdo vaccines either. So I think, again, every barn, every horse is going to be very specific, and that's why that discussion, rather than follow a specific protocol, is going to be very important. The other type of vaccines that you may have heard is about like the core vaccination. So this core vaccination implies more the type of vaccines or the types of disease that involve health risk, and that's why they say core, meaning like you should definitely consider at least, like these 4 vaccines, which include the tetanus, the encephalitis, West Nile, and rabies, especially West Nile and rabies, again, being all these 4 diseases can be prevented if you are vaccinated, and West Nile and rabies can definitely affect humans as well. So again, just something to keep in mind. Herpes is not this core vaccines, it is, but as I say, depending on what you're doing with your horse, that's going to be important. And then lastly, so like what to do, this is kind of like a summary of what to do or actions to be taken if you have any suspected infectious disease outbreak. And I say, just because we're talking about equine herpes virus, but even if you have any other disease that you're afraid, that something is not quite right, like what to do. So we talk about that temperature, if you start seeing anything above like the 1015, then that should like ring a bell, or just start kind of like having some concerns and just rechecking that temperature. Start thinking about like scenarios of how you can isolate that horse a little bit more. Of course, start implementing some moving restrictions. So if you're going to a show, then maybe not go, or as I say, just find alternative like calling your veterinarian or just truly knowing like how concerned you need to be. Some of the time we forget, depending on what time of the year. So as far as vaccinations, then that might ring a bell too, as far as check what your vaccination status on your horse is and see if there's anything that maybe you missed this year that we should have done or not. And then, of course, start minimizing the use of shared equipment. So if you have like big water trough, then maybe just try to just get like a water bucket designated for that horse so you can actually see, how much they're drinking or not. Increase biosecurity measurements, again, that we can thank to COVID. I guess we have plenty of experience of how to wash your hands and how to keep everything clean. So same goes with the horses. And as I say, just if you have any questions, then we're happy to just to answer a call, even if it's just a 1015, and then we can best kind of like direct you of what to do next from there. And then last, I think Troy showed this slide. I just want to make sure that we thank the staff. This last week, it was Veterinary Technician Week. And you can see how in this picture, we do all we do, especially dealing with this equine herpes virus and, all these terrible diseases, thanks to the big family that we are here. Because this is not a business, this is a family. And there's only, in this picture, 15 veterinarians, 10 senior, and then 5 interns. But it truly makes us a whole what we can do, what we do for you guys. So thank you so much.